In this week's edition of The Doctors, we're talking to Dr. Roger Smalligan with Texas Tech Health Sciences Center. The CDC has been talking about a potentially deadly bacteria that could be spreading in the nation, and we have actually found that that bacteria is here locally, isn't it, Dr. Smalligan?
Absolutely. As a matter of fact, I had to diagnose a new case today in the hospital. It's a condition that we have traditionally seen after patients have received high-dose antibiotics for other reasons. And what it does is it cleans out all of the normal bacteria that we all carry in our intestines. After it cleans all of those out with those high-dose antibiotics, this is a bug that then is kind of opportunistic and takes advantage of that lack of competition and begins to reproduce and can give you terrible abdominal pain. It can give you a swollen colon. It can give you high fever, abdominal pain, et cetera. It can become very serious to the point I've had some of my patients have to have their entire colon removed if it gets that bad.
Oh my. Well, let me just tell you, you first heard about this here on the early show. It's called C. difficile or C. diff, right?
Correct.
Okay, so what is the technical term for that?
That's it's a bacterial name, so it's Clostridium difficile is the genus and species. And it is a bug that we've always thought had to be more associated with hospitals or doctors' offices. And I've now in the last year, and I think other people around the country are beginning to see cases where people walk into my office with abdominal pain and diarrhea, and I check for this bug, and indeed they already have it. So we're calling that a community-acquired C. diff, which doesn't go along with that whole theory I just told you of cleaning out the gut first.
Right.
Who knows? It looks like it's on the increase in the United States.
Exactly, and that is exactly why the Centers for Disease Control and Prevention have been researching this, right?
Correct.
And they're also mentioning, and you agreed with this as well, the gel, the hand sanitizer that you use may not be killing that bacteria.
Correct. It can be spread. So yeah, just a little bit of alcohol gel may not clear it. So we're teaching all of our doctors and encouraging everybody in public health to wash your hands for 30 seconds after patient contact to make sure, with soap and water, 30 seconds to try to really get that cleared off.
Wow, that's good to know, because this at this time, so many people just use the gel for that very reason. Very, very deadly bacteria. C. diff, if you haven't already heard of it. And you can check with your family physician for more, or head to our website, newschannel10.com. Thank you,
But there is treatment for it too, so we can do that another day maybe.
Okay, good. Good to know.